Have you ever had a cough that just wouldn't go away? A cough that lingers for weeks, brings up mucus, leaves your chest feeling tight, and makes breathing uncomfortable. If so, you may have experienced bronchitis. But what exactly is bronchitis? What causes it? How do you know if you have it? Can it be cured? And what are scientists discovering about it today? Let's break it down. Bronchitis is a condition where the bronchial tubes, the air passages that carry air to and from your lungs, become inflamed. When these airways become irritated and swollen, they produce excess mucus. Your body then responds by coughing in an attempt to clear those airways. There are two main types of bronchitis. The first is acute bronchitis, which is the most common form. It's usually caused by a viral infection, such as the common cold or flu, and typically lasts from 1 to 3 weeks before improving on its own. The second is chronic bronchitis, a much more serious long-term condition. Chronic bronchitis is defined as a productive cough that lasts at least 3 months per year for 2 consecutive years. It is often associated with chronic obstructive pulmonary disease, or COPD. So what causes bronchitis? In approximately 90 to 95% of acute bronchitis cases, viruses are responsible. The same viruses that cause colds, influenza, and other respiratory infections can infect the bronchial tubes and trigger inflammation. However, bronchitis isn't always caused by infections. Exposure to cigarette smoke, secondhand smoke, air pollution, dust, chemical fumes, and workplace irritants can also inflame the airways. For chronic bronchitis, smoking remains the leading cause worldwide. Long-term exposure to polluted air and industrial chemicals can also contribute significantly to the disease. Now let's talk about symptoms. The hallmark symptom of bronchitis is a persistent cough. This cough may be dry at first, but often produces mucus, which can appear clear, white, yellow, or even green. Other common symptoms include chest discomfort, wheezing, shortness of breath, fatigue, sore throat, mild fever, and body aches. Many people describe a feeling of heaviness or tightness in their chest, especially when breathing deeply. Most cases improve without complications, but some warning signs should never be ignored. Seek medical attention if you experience difficulty breathing, chest pain, coughing up blood, high fever, confusion, or symptoms that persist for more than 3 weeks. Now for the question many people ask, can bronchitis be cured? The answer depends on the type. Acute bronchitis is usually self-limiting, meaning it resolves on its own as the infection and inflammation disappear. Most people recover fully within a few weeks. Chronic bronchitis, however, cannot currently be cured. The damage and inflammation in the airways tend to persist over time. However, symptoms can be controlled, flare-ups can be reduced, and disease progression can often be slowed dramatically. So how is bronchitis treated? For acute bronchitis, treatment focuses on relieving symptoms while the body heals. Doctors typically recommend rest, staying hydrated, breathing humidified air, avoiding smoke exposure, and using over-the-counter medications to reduce fever and discomfort. A common misconception is that antibiotics are necessary. In reality, because most cases are caused by viruses, antibiotics usually do not help and are generally not recommended unless a bacterial infection is suspected. For chronic bronchitis, treatment is more comprehensive. The single most important step is quitting smoking. Additional treatments may include inhalers that open the airways, medications that reduce inflammation, pulmonary rehabilitation programs, regular exercise, vaccinations against respiratory infections, and oxygen therapy in severe cases. Now let's look at some exciting recent research. Scientists are increasingly discovering that bronchitis is not the same disease in every patient. Recent studies are exploring specific inflammatory pathways and biological markers that may help doctors personalize treatment based on the underlying cause of airway inflammation. Researchers are also investigating biomarkers found in blood and mucus samples that could help distinguish viral infections from bacterial infections. This could reduce unnecessary antibiotic prescriptions and improve patient care. Another growing area of research focuses on the impact of air pollution. Evidence continues to show that long-term exposure to polluted air, wildfire smoke, and industrial emissions can significantly increase the risk of chronic bronchitis and worsen symptoms in affected individuals. Advanced inhaler technologies and targeted respiratory therapies are also being developed to improve symptom control and quality of life for patients with chronic bronchitis. So, what's the takeaway? Bronchitis is an inflammation of the airways that can cause persistent coughing, mucus production, wheezing, and breathing difficulties. Acute bronchitis is usually caused by viruses and often resolves within a few weeks. Chronic bronchitis is a long-term condition, commonly linked to smoking and environmental exposure. While acute bronchitis can often be cured naturally, chronic bronchitis requires ongoing management. The good news is that modern treatments, healthier lifestyle choices, and emerging research are helping patients breathe easier and live healthier lives. If you found this video helpful, make sure to like, subscribe, and turn on notifications for more science-backed health content.